Hello, my name is Charlie Birchmeyer, and I did my presentation on congestive heart failure. So I'd like to start with the general description of congestive heart failure. It is when the blood is not getting pumped enough by the heart muscle. Therefore, the heart muscle can be too weak or too stiff to pump the blood. The blood is not getting through easily, and this can be caused by a blocked or narrowed arteries, by high blood pressure, or because that there is blockage on the arteries, therefore the blood cannot get through. The heart still pumps the blood, but it's at a much slower rate that affects the whole body. So therefore, when there's not enough blood being pumped, fluid and blood can set up in the lungs, and it can also set up in the legs and the feet and ankles, called edema. The patient will experience shortness of breath or tired or fatigue also. This does not mean that the heart will stop working or has stopped working when diagnosed with congestive heart failure. It just means that the heart is not working properly, but it can lead to heart failure, which can also lead to death in the end. Etiology: the patient most likely has a history or has high blood pressure at this point of time. They can have had, most likely though, have coronary artery disease when the arteries become too narrow due to the buildup and blockage of cholesterol on the walls. The blood cannot flow properly through the heart, so it does not get the oxygen or blood it needs. The patient may have diabetes, therefore the high glucose of the blood damages the vessels of the blood, of the heart, and the nerves of the muscle. The patient may be overweight, and the patient could have had a history or have had heart attacks that damage the heart. Manifestations. So the patient can experience shortness of breath, like during most activities, while they're at rest or while they are sleeping, and it's like a sudden need to breathe, and like you're feeling the need that you cannot breathe. And so this is due to the fluid that actually leaks into the lungs, and the patient may experience persistent coughing or wheezing, and there may be mucus of pink or white, which is actually some blood, because the fluid that builds up in the lungs, the person feels the need to cough it up since the lungs are so full. The buildup or excess fluid of the body tissues, the swelling of the feet, ankles, or abdomen edema, or they can even experience weight gain, because the blood that is supposed to flow to the heart, there is being backed up through the veins, causing fluid to build up in these tissues. And the kidneys are also less able to dispose of the sodium in the water, causing the fluid retention of the tissues. A person may be very fatigued or tired, such as climbing the stairs or doing the groceries or doing everyday activities. It's because the heart can't pump enough blood to meet the body's needs. So the body diverts the blood away from the less vital organs, and such as the muscles of the limbs, and sends it to the heart and brain where it really needs the oxygen and blood. The lack of appetite and nausea also, feeling full or feeling sick to your stomach. The digestive receives less blood, so therefore it causes problems with the digestion. A person can feel confused or disoriented because of the certain changes of the substances in the blood, such as more sodium, since the kidneys cannot filter it all out, which causes confusion. The heart can feel like it's pounding out of your chest, it's racing and it's throbbing, and it's basically because the heart needs to make up for the loss of its pumping activity, therefore it beats faster. Diagnosis: blood tests are used to check the chemical NT-proBNP. Also, the sodium and potassium levels and the kidney levels are used to see how well they're functioning, and the levels of the sodium and potassium to diagnose the patient. The patient may also have to have a chest x-ray to see pictures of the heart. Electrocardiogram and EKG, the activity of the heart, is very useful to diagnose the patient to see how well it's working. Echocardiogram is where the sound waves show an image of the heart size, the shape, and any abnormalities such as the valves and maybe they're damaged. Also, a patient may have a stress test where they get on a treadmill and they can walk or run or even be asked to wear a mask to show how well the heart works and the health of it. A cardiac computerized tomography, a CT scan, shows the images of the heart. A magnetic resonance imaging, MRI, the radio waves show the images of the heart. And a coronary angiogram is where actually a catheter goes in a vessel of the groin or the arm and goes to the aorta, and a dye is placed and it can show the blockages, if there is any blockages causing the heart not to be able to pump fast enough. And a myocardial biopsy, where the biopsy cord is actually placed in the vein of the neck or the groin, and then pieces of the heart muscle and tissue are taken to be observed. So there's actually stages of heart failure. I based my stages on the American College of Cardiology. They base them on stages A through D, actually. So a person who's in stage A, they may not have any signs or symptoms right now of congestive heart failure, but they are at high risk due to family history or because they have high blood pressure or diabetes or coronary artery disease. Stage B is also pre-heart failure, but you have shown some signs, and you might have an echocardiogram that shows less than 40% of ejection fraction, which is also a sign that you may be going into congestive heart failure. Stage C, you're diagnosed with heart failure and you're showing symptoms and signs. And D is the final stage. This is very severe, and your heart is not going to get better with treatment compared to stages A through C, where treatment options may be available and can actually reduce or limit the damage to the heart. So treatment, it's lifelong. Medications are used. You have ACE inhibitors that vasodilate, that help those arteries loosen up and allow blood to flow through, and they also lower your blood pressure. And you have angiotensin II receptor blockers that also help and do the same thing as the ACE inhibitors. And you have your beta blockers that actually slow your heart rate down and decrease your blood pressure and can actually help reduce or limit the damage of the heart failure if the patient has a systolic heart failure. Diuretics are used. They are water pills. They make you urinate frequently to help the fluid from building up in your stomach, legs, ankles, and feet. And you have inotropes. They remove any of, they help improve the pumping of the heart and help with the blood pressure. They're really used in severe heart failure, such as stage D. And you have digoxin, which strengthens the heart muscle and it slows the heartbeat. If medications are not helping, the doctors might suggest more treatment, such as surgery. There's coronary bypass, which vessels from the arms or the legs are used to bypass that blocked artery of the heart and helps with the blood flow more easily through the heart. You might have a heart valve repair or replacement. Surgeons can repair the faulty valve by removing tissues if it is too tight, causing their blockage, or maybe the valve is too loose around the rings and they can actually replace that or tighten that up. And some may need a total valve replacement, such as a prosthetic. There is implantable Cardioverter Defibrillator, ICD, where wires are placed under the skin in the chest and go through the veins to the heart to monitor the heart rhythm and can shock the patient if the rhythm gets offbeat. A cardiac resynchronization therapy, CRT, is a biventricular pacemaker that sends electrical impulses to the lower chambers of the heart to tell them to do their job. And you have a ventricle assist devices, VAD, a mechanical pump that helps pump the blood from lower chambers of the heart to everywhere else in the body. And then the last Treatment is heart transplant if your heart is just not getting better and there's no other options. Prognosis. Heart failure will allow people to still do the things that they enjoy, just might slow down them just a little bit, but they can still do most of the daily activities that they were doing before. Life expectancy depends on the heart's condition. It depends on how well the muscle of the heart is working, the symptoms the patient is still experiencing, the age of the person, the gender of the person, because it seems that males are more affected by this disease than females in the follow-up treatment plan that the doctor prescribes. This is a progressive and chronic condition that actually weakens the heart and does not allow oxygen to get to the other cells in the blood that the other cells the body needs for function. So a 5-year survival rate, a patient with stage A has a 97% chance, stage B 95.7%, stage C 74.5%, and stage D 20%. Complications: cardiac coccygia, severe and rapid weight loss. So within 6 months, the patient loses 7.5% of their weight. This is more seen, though, in obese patients. Impaired kidney function. As we talked, the kidneys are not able to filter out that sodium in that water that actually makes fluid build up and leads to decrease of the kidney function. So more than likely, if you have congestive heart failure, you also probably have kidney failure eventually. Congestion is when the fluid builds up in the lungs, in the feet, in the legs, in the stomach. Also, you could have a heart attack. You might have fluid retention that causes weight gain. You have a loss of muscle mass because you're so fatigued. And you have pulmonary edema, is when the fluid builds up in the lungs and causes shortness of breath and it feels like you are drowning. Follow-up care. Follow-up lab tests to check sodium, potassium, to see how the kidneys are functioning. You might need repeat EKGs or stress tests to see the condition of the heart. You may need to continue on your medications. Those who've had surgery might need more care than others, more hospitalization, more therapy. It is very important to keep strengthening your heart by light exercise daily. Eat those heart-healthy foods. You need to stop smoking, abusing alcohol. You might need to lose weight. No stress is very helpful, and do not overeat. Prevention. As stated earlier, stop smoking, eat a heart-healthy diet with low sodium, potassium, and low fat. You need to maintain that healthy weight. Do not overuse your alcohol. Exercise daily, 30 to 60 minutes. Go to your routine doctor visits. Get your routine blood work to see any abnormalities. Control your cholesterol and triglycerides to keep your blood pressure low. Do not put too much stress on yourself because this will raise your blood pressure, and manage your diabetes if you have it. Thank you all for listening to my presentation on congestive heart failure. Here are the references that I used to complete this presentation. Thank you.